We're here today to talk about the exercise you can do before and after you've had a total knee or a unilateral knee replacement. These exercises are designed to strengthen the joint, strengthen the muscles round about the joint to help support, and to get the movement back into your knee following this operation. It's important to do these exercises before and after the operation and do them regularly.
So are these going to hurt, big man?
They're going to hurt a little bit after the operation. Before the operation they shouldn't hurt at all. After the operation there will be a bit of pain because you have had a major operation, but they're really important to help with the benefits I've already spoken about, so we would always expect you to be able to do them.
And when are you expecting me to start doing these?
So you can start these exercises the day of surgery. As has been discussed before, we get you up and about on the day of surgery, so it's important that we start getting these muscles working on the day of surgery and the subsequent days after that.
So I've heard a lot of stuff about physiotherapists. I'm not wanting to be too sore when I'm doing this.
Not at all. Hopefully you won't be too sore. There obviously will be a bit of pain, but we'll work with the nursing staff to make sure that you're getting the pain relief that you need. And when you go home, it's important that you do take pain relief regularly so that you're able to do your exercises to get the best result.
And if I'm really sore when I'm doing my physio, are you guys going to listen to me when I ask?
Yeah, of course we will. It's important that we're here to push you and to try and get you to the kind of limits of what you can do, but we're obviously not here to cause too much pain. So we will listen to you, and we'll make sure that we're listening to what you're telling us.
All right. It hurts a bit at the moment. That's why I'm having the operation. So have I to do these before I go?
Yeah, if you can. Yeah, it'll really help to strengthen. Actually, what you might find is actually some of your pain gets better with doing these exercises because the muscles are working a little bit harder round about the joint.
You would say that.
Trust me, I'm a physio.
Okay.
Okay, so we're going to get started with the exercises. So the first exercise, we're looking at the knee joint here, and we're looking at pushing the knee joint into the bed. Okay, so if you just squeeze this muscle here and you're squashing down, lovely, and you can see that the heels come off the bed there a little bit, and that shows that the muscle's working really hard. And relax. Good, so we're pushing down, squeeze this muscle, push down, and holding for about 5 seconds, lovely, and relax. Good, we'll do one more, push down, lovely, and relax. Good. For the purpose of the video, we're going to do 2 or 3 of each exercise, but when you're doing them at home, we'd expect you to do up to a maximum of 10 once you're able to manage that. Okay, the next exercise, we're going to use this here, and this is just a rolled up towel. At home, you can use a rolled up towel, a cushion, a pillow, anything like that is going to give you a little bit of a lift. So I'm going to ask Graham if you can bend your knees slightly. I'm going to place this under the knee, and we'll just let that relax there, okay?
Oh, that's quite...
Again, you're squeezing this muscle, you're pushing down into the towel, and as you do that, this heel will come right off the bed there. Lovely. Good. And relax it back down. Okay, so again, we're squeezing down, lifting up, holding for 5 seconds. Good, and back down.
So
Lovely.
I'm going to be able to do this the day of the operation?
Absolutely, yeah, the day of the operation, this is what we're expecting. Some people will maybe struggle with it initially, but that's what we're there to do.
My neighbour said that they couldn't move their leg for 2 days, after the...
Usually people are able to move straight away. Usually people, we can get them to do this exercise, and if they're not able to manage it, we can work with them really hard to try and get the muscle working harder.
He said something about a block, something to do with a nerve.
So we would always wait that. You will have a nerve block, or some people will have a nerve block. So we'll always wait until that's worn off before we start getting you doing these exercises or getting you up and about on your feet.
Right.
Okay, so we'll just do two more of these. So we're just squeezing down, lifting, hold, 2, 3, 4, 5, and relax. Good, and one more. 2, 3, 4, 5, and relax. Lovely. Okay, so we'll just bring this out of here. Okay, the next exercise again is working on this muscle here. This is the quadricep muscle. So for this one, we're going to keep your knee as straight as you can. You're going to tighten this muscle, okay, and you're going to lift your leg just straight off the bed, about 6 inches, and you're going to hold it there. 2, 3, 4, 5, and back down. Lovely.
That's a big 6 inches.
And lift again. Hold, 2, 3, 4, 5, and back down. Lovely. One more. Lift and hold. 2, 3, 4, 5. Good. And back down. Excellent. So that's all the exercises we do for the quadriceps when we're on the bed. The next exercise, we're looking at your movement, okay? Now I've got a plastic bag here. Now this plastic bag is obviously can be just to reduce friction, okay? So what I'm going to ask you to do this time is I'm going to ask you to pull your heel up towards your bottom, okay? So we're going to bend the knee, let it bend, let this slide, 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 slide. Good. And then let it slide back out nice and slowly. Good. Now we just put a plastic bag in just to reduce friction if you're doing this on your bed at home. Okay, so again, slide up towards you. Good, and then let it slide back out.
Oh, that's easy.
It's easy now. Obviously after your operation, this is one of the exercises that's really important, okay? It's really important that we get this bend into your knee. Lovely.
So if I can't really bend it, what am I doing?
So we can give you a few hints and tips, and it's really important that we keep trying to push that movement. You get it to a point where you feel it can't really go any further, hold it there, and then you let it back out. And hopefully as time goes on, that movement will get bigger and bigger.
So I have to keep trying to push beyond where I got to?
Absolutely, yeah, really important that we're pushing this exercise.
Okay, and how do I know when I'm getting as good as it's going to be?
So for this exercise, we're looking at getting to 90 degrees of flexion. Now 90 degrees means that's a right angle, so we're looking for that angle there of your knee before you leave hospital, or as close as we can to that.
About there?
A little bit less. About there is what we're looking for, okay?
Right.
So we're looking for about 90 degrees, and then we'd let that back down.
So will you keep me in if I can't get to that?
We'll have a look at it and we'll see what movement you're getting to. If you're getting close to that and you're doing really well with your exercises, no, there's no problem with that, we'll get you home. And if you're really struggling with the movement, we can get you some physio follow-up in an outpatient setting.
Right. So when I leave, there'll be more physiotherapy?
For some people, not everyone needs physio follow-up. Some people need it, some people don't. We'll assess that on an individual basis in the ward, and we'll get that referral done if that's required.
Right, so it's only going to be if I need it then?
If you need it, yeah. Most people do absolutely fine going away doing their exercises themselves and don't need that follow-up. But as I say, if you need it, there's no problem with getting that.
Okay.
So in summary, the exercises that we've got when you're lying down are pushing your knee into the bed. Lovely, good. We've got the one with the pillow or the cushion.
Oh, that's comfy.
Where you're squeezing down, lifting up. Excellent, and relax. We've got the exercise where you're lifting the legs straight up, keeping it as straight as you can.
Got to get it straight as I can, and then
lift and hold. Good. Back down. And then you've got the last one with the plastic bag. And pulling up. Excellent. And back down. Okay, so we'll just take this bag away. Okay, so the last exercise in lying is we're going to pop this roll under here, okay? Now what this does, this gets the straightness into your knee. Quite often when you've had an operation and before you've had a knee replacement, sometimes your knee can have a bit of a bend in it and it's actually kind of stuck at that angle. So
what, you mean like?
Yeah, exactly. Some people's knees can be stuck at that angle, and after they've had their operation, it's really important that we aim to get the leg nice and straight, okay? So this is a really nice rest position, okay? So you wouldn't want to rest in this position all day, but holding it in this position for maybe 10-15 minutes, okay? Just to really let those muscles relax at the back of the knee and let the joint get used to being straight again, okay? In that position as an exercise, you can also just do a little push down, so what you were doing before, lovely. Push and relax, again, push down. And that's sometimes one that does hurt a bit at the back of the knee, but again, it's really important that we're getting that movement and we're getting that knee as straight as it'll go.
So I've got to get it completely straight and then I've got to get it to bend as much as it'll go.
That's what we're aiming for, yeah. So we're aiming to get that nice straightness, which we call kind of 0 degrees. And then that's the straightness. And then for the bend, we're looking for that 90 degrees or as close as we can to it.
Okay, but if I go over 90, is that a problem?
Absolutely, no, not a problem at all. That's what we're looking for. If you can get over 90, that would be great. But 90 is what we're looking for before you leave the hospital. Okay, so we'll take this away. And the last exercise is important to do after your surgery to get your ankles moving. So just pushing your ankles towards you and then pushing them away. Lovely. And just pulling them back. Excellent. Now what that does is just gets the muscle pump working up your legs when you're not as mobile, when you're not up on your feet as much. Okay?
Okay.
Good. Okay, so in summary, the exercises that we've got, you are pushing your knee down onto the bed, squeezing that muscle. Excellent. And relax. Good. You are sliding this rolled up towel in and you're lifting up here. Good. You are lifting your leg straight up off the bed, keeping it as straight as you can. Good. You are using the plastic bag to get bits of bend into your knee. You're sliding all the way up and then all the way back down. You're using the roll again under your heel this time to get that nice straightness into your knee, and you can use that as either a rest position or doing a bit of a squeeze to get a little bit more straightness into your knee.
So this one takes a bit longer to do.
Yeah, this one takes about 10 minutes. This is the one that's for the rest position.
Okay.
Good. And the last one's just the ankles back and forward. Good. Okay, happy with those exercises?
Fine.
Good, excellent, thank you.